Consultation fees by medical practitioners change by the day according to the preference of the supplier. This to some Ugandans seemed to be the cause of the increased cases of self-medication which risks life of several Ugandans. Much as there exists a patient's charter that splits the rights of patients and how they are meant to be handled, not so many Ugandans know these provisions, let alone its existence. It's against this backdrop that the Center for Health, Human Rights and Development (CHHD) calls for the National Medical Council to intervene and standardize consultation fees to save Ugandans who have opted to shun medical centers because of the escalating consultation fees. Dennis Chibila, the acting director of HELPS Uganda, says most Ugandans have opted to go to health facilities and instead take on self-medication, which in turn puts their lives in grave danger.
Consultation fees is that people then shun away from going to the clinics, and what that means is that it encourages self-medication and very unnecessary habits of irrational use of medicines. And so as a country we really need to look into that area to ensure that patients can access the doctors at an affordable price.
Chibila also says access to medicine is another issue which is often unchecked. It is a right for every Ugandan to know how procurement is done so that national medical stores does not fail to supply drugs in pretext that particular drug were not requisitioned for.
Higher price. Certainly the issue of procurement needs to have more scrutiny to ensure that we have value for money, but also there are shocks we get from...
Ibrahim Sarikwa, Programs Officer at the Center for Health, Human Rights and Development (CHHD), says more effort is required to improve access to medicines, especially the essential ones.
And they are trying to elaborate on some of the rights that a patient has and some of the responsibilities. And some of these rights, we have the right to privacy, where if we have a discussion with the health practitioner, this discussion has to be kept as a private issue. This touches also the issue of confidentiality. We have instances where health workers go to bars and spill out issues of patients.
He adds that Ugandans need to know their rights when it comes to matters of health, citing a case when people are not often treated but denied information about the prescription.
Provisions like access to health information, where a patient has a right to receive his or her medical records. But in many facilities, most of the private facilities, patients are not given their medical documents. They are taken as facility documents, yet they are personal documents of health workers.
Because of such challenges and complexity knowing the existence of the patient's charter, CHHD opted to train journalists to sensitize Ugandans on the existence of patients' charters and also to know remedies in case of any breach.